Section 3. Additional precautions. Additional precautions interrupt the transmission of infectious agents. These practices will help protect each and every one of us from the transmission of infection. This section will teach you about the principles and the categories of additional precautions. You will also learn about the different categories of additional precautions. When you see an additional precaution sign, do you know why a sign is posted? Why wearing gloves or gown or mask may be necessary before entering the room? It is essential to understand modes of transmission, definition, and description of categories additional precautions categories. You need to know when and how to use additional precautions. You will also be able to apply the principles and elements that comprise additional precautions. There are 3 categories of additional precautions. 1. Contact precautions. 2. Droplet precautions. And 3. Airborne precautions. Contact. There are 2 types of contact transmission: direct contact and indirect contact. Direct contact transmission occurs through contaminating an individual directly by touching them. Indirect contact transmission may occur by touching contaminated equipment and/or surfaces in the environment, and then touching ourselves or another person. Examples of microorganisms that may be transmitted through contact are norovirus and C. diff. Droplet. Droplet transmission occurs when droplets carrying an infectious agent exit the respiratory tract of the infected person and come in contact with the mucous membranes, such as the eyes, nose, and mouth of another person. COVID-19 and influenza are examples of droplet transmission. Due to the weight of these droplets, they do not remain in the air. They usually travel around 2 meters or 6 feet. When we cough or sneeze, these droplets that land on surfaces can contaminate the environment. They may live on some surfaces for a long period of time. Airborne. Airborne transmission occurs when infectious particles remain suspended in the air, travel on air currents, and are then inhaled by people who may be nearby or some distance away from the infected individual. Tuberculosis, chickenpox, and measles travel through airborne. Additional precautions measures used to manage infection transmission. They are used when routine practices alone are not sufficient to prevent and control spread. Depending on the infectious agent or agents, additional precautions may be combined. Most respiratory infections need droplet or contact precautions since they are mainly spread by both droplet and contact transmission. It is crucial to start additional precautions as soon as symptoms suggestive of a potential transmissible infection are noted. The discontinuation of additional precautions should be done as soon as safely possible and when the risk of transmission is no longer present. Elements of additional precaution. Accommodation. It is preferred that individuals who are on additional precautions are placed in a single room with a dedicated equipment. The door to the individual's room may stay open. However, individuals must stay in the room to help decrease the risk of spreading infection. If the individual must have a special test, such as an X-ray, then the clinic they are going to needs to know the individual is on additional precautions. Each individual's ability to follow precautions needs to be assessed to assist in determining the best accommodation. Developing an individual care plan. If a single room is not available, the infection risk to other individuals in the room should be considered in making the decision about accommodation. Signage. In a single room, a proper signage needs to be placed at the entrance to the individual's room. If the individual is in a multi-bed room, then the sign would also be needed by the bed space to determine the infected individual.